So in the first few visits with the physical therapist after surgery with partial knee resurfacing, we want the physical therapists to be looking and thinking about the same things that I would think about in the office. So some of the things in the first few visits that we look at is evaluation of the surgical incision and the wound to make sure about wound drainage, cellulitis, and healing. Because the first thing that we want to do is get a seal of that wound with a good scab and a scar with no leakage and no ability to obtain either superficial or deep infection. Next, we look for blood clot, DVT, by palpating the calf muscles and seeing if there's tenderness. Any concern would indicate a call to the physician, possibly even a referral to the emergency room for an ultrasound to look for DVT, and in a worst case scenario, even a pulmonary embolism. We want to be very concerned about any blood loss, anemia, heart rate monitoring, shortness of breath, anything that would be of a medical complication. And the physical therapists who are able to run patients through more rigorous testing than we can in the office oftentimes can unlock complications at an earlier rate. So we love working with physical therapists for those reasons. Post-operatively, physical therapy is very important to resume the patient back and get them on the best track for recovery. So we do gentle range of motion. Passive range of motion is really good with a physical therapist, slowly increasing our active range of motion. We eventually, once we get enough knee flexion, want to get them on a stationary bicycle. Really important metric is to get to 90 degrees of flexion. Once we get around the corner past 90 degrees, we know that we're on the road to good recovery. Occasionally we will need to consider manipulations under anesthesia if we don't get that knee flexion, and so we love working with physical therapy on passive and active range of motion to decrease scar tissue formation and decrease swelling. We use ice packs. Eventually we get into whirlpool and heat packs and passive stretching. These are the most important early phase treatments.